This video is looking at wrist drop and massage. Wrist drop wrist, radial nerve palsy, radial neuropathy are all the same thing. They're almost always caused by damage to the radial nerve, which then leaves the client unable to use their hand. A person with drop wrist will find they're unable to extend the hand or to raise the hand using the wrist. The hand or wrist might be weak and the fingers might also be affected. The radial nerve runs down the underside of the arms and controls movement in the triceps. It's also responsible for extending the wrist and fingers, and it controls some of the hand sensation. It's one of the 3 nerves that carry signals from the brain to the hand. An injury to this nerve can block normal nerve function. The person might experience widespread numbness and tingling throughout the wrist, the hand and the fingers. There might be wrist pain, tenderness or swelling, and pain in the forearm close to the elbow. So we just look at a couple of very specific moves for wrist drop. You can see here I've supported my client's hand in mine and I'm kind of holding it open using my little finger entwined with his little finger and my thumb entwined with his thumb. And what I want to do is stretch this area, all of the thumb, out towards the wrist. I'm using a bit of lotion here rather than oil because oil will get a little bit too slippy. And you can see because I'm holding the wrist out, any contracture that's starting to develop, I'm working against that, which is what we don't want. We don't want that contracture developing. So you can use slide. I can hold the client's hand like that. I can hold the thumb back and I can work this way. Now bear in mind, if the client happens to be pregnant, we're avoiding this area of the thumb, but we can still do this sliding workout. It's not going to matter if you fleetingly glance over that. It's sustained work there that causes the problem. You could, if you wanted, use a knuckle. It depends on the size of the client's hand. If the client's doing lots of manual work before they develop their wrist drop, then you might need to use your knuckles rather than your thumb, because even though there's currently no control over this area, you'll still have that muscular built up from before they develop the wrist drop. And finally, we just have a gentle wrist stretch. You can see Pete's resting his hand onto the table so that his hand can be nice and relaxed. With my opposite hand, I'm just restraining his hand. I'm holding it so that I'm supporting it there, and I'm going to intertwine my fingers. And all we're doing is moving the wrist around its natural movement. It might seem a very simple thing to do, but if you think with wrist drop, you've lost that mobility in the wrist. So what we want to do, the whole aim of this, is just to keep that wrist moving as it is. Now there might have been some pre-existing restriction. You can see there's a little bit there in Peter's. So it's a little bit jerky there. That was there already. So I'm not going to worry about that. What we want to do is just to keep all of this joint, all of these tendons moving, to keep the muscles moving, the ligaments, all of the connective tissue, while that nerve repairs, so that he can have the movement back in his wrist again. And again, this is something that you can teach your client to do at home, because the other option is that they could do it with their own hand. So they could use their good hand to move the wrist that's been impacted by the wrist drop. And so doing this just keeps everything moving while that healing takes place.
If you found this video useful and want to see more like this, make sure you subscribe below and don't forget to hit the notification bell.